Kenya, a beautiful sunburned country of magnificent sceneries and magnificent cities. The heart of Kenya, Nairobi, is a place of big international businesses that run the world, and the small, local ones. They're all important. Kenya is a big land of big opportunities, but as every country in the world, it's got its issues.
So according to Joel, because of lack of enough health facilities, they usually use herbal medicine in case people are sick. Just leaves and branches and roots of trees. That's what we refer as herbal medicine in this part of Kajiado. So basically the old people, they know what type of trees can be able to treat this type of ailment. So when someone is sick, they just visit the special, like the herbalist.
But herbal medicine fails when a patient is on a long waiting list for a spine surgery. To fight this challenge, the representatives from KCM Hospital in Poland joined the eHealth Summit in Kenya and presented a solution with top-class healthcare, easy and affordable for Kenyan patients, but also for patients from all over the Africa. What they've presented attracted a lot of attention, also in media.
Okay, as you know, approximately 10,000 Kenyans travel abroad annually to seek specialized treatment. This translates to about 10 billion shillings, and KCM is offering one of the solutions around which the team is going to tell us more. Maybe tell us, who is KCM?
KCM Clinic, we are a private hospital specializing in minimal invasive surgeries. Can you tell us more?
Yes, well, generally speaking, we solve the problems. So every time we hear voices from different countries, like for instance Kenya at the moment, we come over and solve them.
So what is your target, or what do you want to achieve in Kenya?
What we do for now is treating patients in Kenya that cannot get the treatment done in your country. So there are hospitals in your city, here in Nairobi and in Kenya, but unfortunately they don't provide the medicine which is available now on the worldwide market. We are speaking here about very specialized spine surgery, orthopedic surgery, bariatric surgery.
Shortly after, KCM Clinic hosted an inspection from Kenya.
Good afternoon. We are here at KCM Hospital in Poland with Dr. Njoki, our guest from Kenya. How are you today?
Very well, thank you.
Right.
I'm an obstetrician gynecologist, and recently I've been doing a lot of healthcare management in the insurance sector. Okay, there are a number of reasons why Kenyan patients feel they want to travel abroad for treatment or for a second opinion. One, and the most common one, is lack of equipment or lack of facilities. For example, in Kenya, we still don't have a PET scan machine. So if a patient has cancer, and we know that the PET scan is very important for the diagnosis and monitoring of treatment, then they have to travel out of the country to get a PET scan done. And then, of course, there are some procedures and some techniques that we still haven't acquired or refined in the country, or we don't have specialized equipment. There's some other procedures that the waiting list is very long, waiting list, and so of course if a patient needs to have surgery sooner, then they prefer to have it abroad because it's faster. So with my recent experience, I have the Kenyan patient very much at heart, and I understand their needs in terms of treatment, financial capability, and that the Kenyan patient deserves the best of care, even with limited resources. So I'm here in Poland to investigate and see whether this is a viable country for us to do medical exchange, medical tourism, collaboration with the doctors, and to make sure that the patient can receive the best of care from Kenya to Poland. And I'm sure I'll figure it out and see whether it's worthwhile sending our patients to Poland for treatment or collaborating with the Polish people to give Kenyans better health care.
So doctor, you've seen the surgery already?
Yeah.
And one of our operating theatres.
Mm-hmm.
What do you think so far?
Very okay. I think the surgeon has found a technique to simplify what is considered a very complicated procedure. And usually for that procedure,
one of the biggest things is the complications. But his technique has made it very simple. I was very impressed. And very quick. I mean, we were done like, when we came in, they had just started. And very quickly, he seems to have mastered the art of doing it. And so I'm quite impressed. I'm very impressed, yeah. The president and his government in his second term of election has come up with an agenda that has got big, what they're calling the big 4 priorities for his government, and one of them is health, and their target is to have universal health coverage for all Kenyans, and the vehicle that has been given that mandate to provide universal health care is NHIF. Okay, so NHIF is trying to offer comprehensive coverage of health care for all the people who are entitled or enrolled on NHIF. Yeah, so I'm excited to be here because Poland is a new gem that we've discovered that has got excellent medical care, and we can bring our patients here. It's also quite affordable and very high standards of care. So it's exciting to be in Poland.